Hi, I'm Luke.
I'm Rich. I'm Robbie, and this is our presentation on the trapezius muscle.
So we're going to start with the origins and insertions. And you see the picture all the way to the right. The yellow is going to be the upper trap, the blue is going to be the middle trap, and the red is going to be the lower trap. And then that other picture next to it, that's the levator scapulae. So the upper trapezius originates at the external occipital protuberance of the skull and spinous process of cervical vertebrae 7, and inserts at the lateral third of the clavicle in the acromion process of the scapula. The middle trapezius originates at the spinous process of thoracic vertebrae 1 through 5, and inserts at the superior aspect of the spine of the scapula and the acromion process of the scapula. The lower trapezius originates at the spinous process of thoracic vertebrae 6 through 12, and inserts at the spine of the scapula. Then the levator scapulae originates the transverse process of the cervical vertebrae 1 through 4, and it inserts at the superior vertebral border of the scapula. Concentric actions, the upper trapezius does cervical extension, which is moving your neck back, lateral flexion, side to side like that, and then rotation, and scapular elevation, which is raising your shoulders. The middle trapezius does scapular retraction, which is pulling your shoulders back. The lower trapezius does scapular depression, so lowering your shoulders. The levator scapulae does cervical extension again, lateral flexion, and ipsilateral rotation in the scapula is anchored, which means if you're turning your head to the right side is going to be the side doing concentrically acting, and it assists in elevation and downward rotation of the scapula. The eccentric actions, the upper trapezius does cervical flexion, which is lowering your head, lateral flexion, rotation, and scapular depression. The middle trapezius does scapular protraction and elevation, which is pulling your shoulders forward. The lower trapezius does scapular elevation, and the levator scapulae eccentrically acts for cervical flexion again. Contralateral cervical rotation, which means if you're turning your head to the right again, this time it would be your left side, eccentrically acting. Lateral flexion, and scapular depression, upward rotation, which is this when the neck is stabilized. Isometric actions, the upper trapezius stabilizes the cervical spine and the scapula, and it also stabilizes the medial scapula, which allows for stability during scapular abduction and upward rotation. Then the middle and lower trapezius stabilize the scapula. The levator scapulae stabilizes the cervical spine and the scapula.
All right, so then we're moving on to the main antagonist. The antagonist opposes the main action of the prime mover. And so for the upper trap, that would be the latissimus dorsi because it is opposed to the scapular elevation and upward rotation of the upper trap. The pectoralis minor would also be one of them. The middle trap, the serratus anterior and the pectoralis minor would be considered antagonist because it directly opposes the scapular retraction of the middle trap. The lower trap, the levator scapulae, the rhomboids, and the pectoralis minor are also antagonists because it directly opposes the scapular depression and downward rotation. And levator scapulae, the lower trap, and the serratus anterior, the lower part of that muscle would also oppose because it directly opposes the function of the levator, which is the elevation and downward rotation. And then the upper trapezius could be an antagonist for the lower trap, and the lower trap can be an antagonist of the upper trap because it directly opposes each other's actions. And then we look at the range of motion test, the upper trapezius and the levator scapulae. That would be the cervical spine range of motion test because when we do cervical flexion and contralateral side bending, that lengthens the muscle and tests for its extensibility. For the middle trap, it would be a scapulothoracic range of motion test with horizontal adduction and scapular protraction. Again, doing those motions would test for how long the muscle could be and test for the extensibility. And then for the lower trap, the scapulothoracic range of motion test, the scapular elevation and downward rotation would lengthen the muscle, therefore testing for its extensibility. And then we move on to the manual muscle test. This is essential for seeing how well the muscle can resist and produce force and stabilize. And so for the upper trap, the direction the practitioner would do is downward on the shoulder. For the middle trap, it would be downward towards scapular protraction to resist that scapular retraction of the middle trap. The lower trap, the practitioner would do downward towards scapular elevation to resist that's function, and then the levator scapulae would be downwards on the scapula. And then here we see that the practitioner is pushing down and is resisting scapular elevation. Here we see the practitioner is pushing down on that shoulder when it's abducted 90 degrees to resist scapular retraction to test that muscle. And then the lower trap downward towards the distal forearm, it would resist the upward rotation. And you can see that here. And then for the levator scapulae, you can see this here, resisting the function by resisting scapular elevation and cervical rotation just to test that muscle.
All right, for isolated exercise for lengthening and stretching the muscles for the upper traps, we have thread the needle. So start with your hands and knees. Reach one arm, which is your right side, for example, on your chest, resting your shoulder and cheek onto the floor. Then gently press your opposite hand into the floor to deepen the stretch in the upper trap and shoulder area. Hold it for 20-30 seconds and switch on the other side and do it again. For the lower traps, see a twist. Sit on the floor with legs extended, bend your right knee and cross your feet over your right leg. Then put your left elbow onto your right knee and then gently twist your torso to the right, feeling the stretch of the lower trap. Hold it for 15-30 seconds and repeat on the other side. All right. For the armpit sniffer stretch for the levator scapulae, for the muscle you want to stretch, which is, for example, the right side, you want to turn your head to your left, bring your chin down to it's kind of like sniffing your armpit. Use your opposing hand to kind of press onto your head and then gain a nice stretch. Then hold it for 15-30 seconds. Then switch it to the other side and repeat again. For the mid traps, do scapular depressions and focus on bringing your shoulder blades down towards your hips. For isolated exercise for activating the muscles for the mid traps, you want to perform face pulls. So pull the rope attachment towards your face, flare your elbows out, and squeezing your shoulder blades together. For the lower trap, you want to do Y raises. So starting in a prone or staying position with a slight bend, lift your arms to form a Y shape, driving your elbows and pinching your shoulder blades down back. Right. For upper traps, we want to perform dumbbell shrugs. So stand up bright and tall while holding weights on each hand. Lift up your shoulders towards your ears, squeeze at the top and lower the weight down slowly. For the levator scapulae, do levator scapulae raises with the weight. Sit upright, hold with a light weight. Scoop your shoulder forward and towards your ear like a small shrug. Hold it for about 5 seconds and lower the weight slowly back down. For functional activities for both the levator scapulae and the trapezius, they both essentially perform scapular movement and stabilization, help both support postural. They also assist and stabilize during arm elevation and also stabilizes during neck movement. Any potential injuries for the trapezius, it would be muscle strain. Some causes would be from poor posture, some heavy lifting, sports, trauma, or any car accidents. And it can go from mild all the way down to severe, which is grade 3. For the levator scapulae, the potential injury is a levator scapulae syndrome. Some causes would be poor posture, stress and anxiety, acute trauma, and cervical spine dysfunction.
And then for the test questions, here we chose a patient presents excessive scapular elevation, downward rotation. What muscle is most likely underactive? If you would have said lower trap, you'd be right because that performs an action that opposes that. It produces scapular depression and upward rotation. And so that opposes the excessive elevation and downward rotation. And then for our second question, we have when performing a manual muscle test, what the examiner should apply resistance in which direction when testing for the middle trap. And if you would say C, force directed towards the scapular protraction, you would be correct because the practitioner wants to resist the scapular retraction of the middle trapezius. And then here are references, and thank you for listening to our presentation.